Hi everyone, welcome. I'm Debbie Mathias, Director of the QRIS National Learning Network with the BUILD Initiative. First, I have to take a minute and do a little commercial. We have so many upcoming activities that are very exciting. I'm sure many of you already know about the QRIS National Learning Network meeting this summer, July 23rd through 25th in Denver, Colorado. We're so excited to be able to provide this opportunity again this year with so many wonderful national partners for the 2014 national meeting. We're now accepting applications, and I'm sure many of you have already submitted or are working on very creative proposals for us to consider. I'd like to really encourage folks from the state in the trenches to submit proposals for this opportunity, as it's you doing the work in the field that informs us nationally about promising practices and state of the art in terms of what's going on in the states. We also have an initiative. We're working with Child Trends to update the national compendium that was first researched and put out in 2010. I'll be sending an update to state leads about the project and timelines very soon. We recognize the need for an updated compendium since the last one in 2010, and I'll tell you, no one realizes that better than me, as I get calls probably every week from states or emails saying, what's the percent of family child care home participating in QRISs, or how are states conceptualizing assessment in their QRIS standards, or a variety of other interesting questions that we all have on the policy and implementation side. But in order to answer these questions, we need a good, strong, web-based, updatable set of data to be able to investigate. So we're very, very excited about this initiative and hope by this summer at our national meeting to be putting this compendium up online for all of our youth. And you'll be able to run reports right off of it from your own state to answer your big questions. So we're very excited about it. The next Let's Talk is on Wednesday, March 19th. It's Massachusetts, QRIS, and NAYC program accreditation talking with us about creating alignments for streamlining quality improvement. And I know many of us have seen up online, and Megan, I'll get the web link for you and we can post it. The feds have posted a crosswalk between Head Start and NAYC and other national sets of standards where you have to create a login and a password, but then you can go in and by section create a topic, create crosswalks of different standards that states are using. Megan, before I go any further, can you give us the update about how to put ourselves on mute and how to get off of mute, just so we have that back of our head?
Absolutely. I was actually going to interject. I'm just going to go ahead and hard mute everyone and then provide instructions for unmuting when conversation begins. That's just a little more foolproof.
Okay,
the conference has been muted.
Okay, so Debbie and Bentley, you'll go ahead and manually unmute yourself using *7. Debbie, it's *7 to unmute.
Hello, am I on yet? Yes.
Yes, we hear
great.
you.
Okay,
Perfect.
great. I was just talking for a while to myself here on mute. Okay, so like I was saying, our next webinar is March 19th, and it's talking about alignment between accreditation and the quality rating improvement system work that states are doing. So without further ado, I'd like to welcome you to the Let's Talk session, Validating Licensing Compliance and Quality Early Childhood State Systems. This series is made possible through the support of the Alliance for Early Success, along with other generous supporters. We began this series for state quality administrators to support their important work within states around early childhood systems building. Quality administrators are welcome to invite other participants as related to the specific topic of the Let's Talk series. And we know a number of you invited your research partners to join us today for this conversation. We hope these calls enable us to share challenges, innovation, and promising practices between us. PowerPoints, resources, and the audio presentation of this session will be posted on the QRIS NLN website under the webinar section. If you have folks in your states that were unable to participate today, they'll be able to go in and listen to the session and review the materials. After the session, a survey will pop up asking for your suggestions, resources, or questions that you'd like to tackle in a future Let's Talk, and we would appreciate your input. If you're working on a promising practice in your state, please reach out and send me an email. Volunteer to present it and engage with colleagues and those around the country on the topic. A few thoughts as we begin our discussion today. The information from this session is coming at a critical time for QRIS development. As funds get tighter, we're all thinking about how we can better leverage the systems together to reduce duplication and to support a coherent framework where the multiple program standards are aligned and programs and communities understand how it all works together. Dr. Fini and Dr. Ponder have been investigating the relationship between differentiated monitoring and licensing and the applicability of this strategy in a QRIS context. It's extremely interesting work that really calls into question the context and the connectivity between different sets of program standards and how these concepts might have the possibility of being generalized to other program types as well. We want to make this as interactive as possible, and we need your help. We have selected breaks in the presentation to hear about the work in your state or to have you ask a question or pose something you've been thinking about from the work in the trenches in your own state. We have the questions and ideas that participants sent with their registration up front, and we'll intersperse those thoughts throughout. We encourage you to be full participants in the session through your comments, questions, and shared experiences. I know I'm already starting to write my questions for the presentation. Simply use the feature on your screen to raise your hand and let us know that you want to speak. We'll recognize you and invite you to unmute your phone when there's a lull in the conversation or an opportunity to take a question. Or if you prefer, you can type your question or comments right in using the chat box feature. You can send it directly to the speaker or you can share it with the entire group. Well, to start off this presentation, Dr. Fini is extremely sorry that he's unable to join us today. And Bentley, thank goodness, has agreed to stand in and help us with the underlying concepts prior to presenting on the Georgia-specific experience. I'd like to introduce Bentley Ponder. You've all reviewed his bio, and thank him profusely for doing double duty for us today on this webinar. As you'll see, he's a gifted researcher who's able to make the research understandable from both the policy and implementation perspectives. And without further ado, I'd like to ask Bentley to take it away and unmute himself. Bentley?
Star 7 to unmute.
Or your headphones. Sometimes if you mute yourself on the headphone, that's another.
Yeah. Okay, here I am. Can you hear me okay now?
Yes, perfect.
Okay. I apologize. Good afternoon, everyone. I'm Bentley Ponder, and I am the Director of Research and Evaluation here at Department of Early Care and Learning in Georgia. And let me just say I'm really excited to do this presentation, and I so appreciate Bill giving us the opportunity to present the research and the work that we've been doing with Dr. Fini. This work has helped us think about our licensing system much differently. And as excited as I am to tell you about the work that we have done, I'm just as excited to tell you the work that we're going to be doing as a result of this work. Just a couple of disclaimers. So as Debbie mentioned, that Dr. Fini is unable to join us today, and so the part of Dr. Fini will be played by Bentley Ponder. So I am by no means Dr. Fini, and I will go through his slides as diligently and efficiently as possible, but if there are any questions for him, we'll be glad to forward that along. The other thing that I would issue as a disclaimer is that, for me as a participant in webinars are sometimes challenging, and as a presenter in webinars are equally as challenged. So if I'm going too quick or you have questions in the middle of the presentation, please feel free to interrupt me or ask a question. I want this to be as productive and interactive for you as well. I also have with me Christy Lewis, and she is our Assistant Commissioner for Child Care Licensing. And since so much of what I'm talking about are specific policies that we're enacting in Georgia, I asked her to be a part of this presentation so that she can answer some of your questions. So with that being said, let's go to the first slide. Okay, so before I get into this slide, and I really will go through this one quickly because this is one from Dr. Fini, I have to say this work has helped us in Georgia look at things really differently. And for me, what this means is it's not just looking at our licensing as part of a larger system, and I'm certainly glad that we have moved there, but also looking at licensing as a system in and of itself. And when I say that, it means I mean that the validation things that we're doing, the validation activities that we're doing under many of our quality programs like our quality rated and pre-K are also very applicable under licensing. And so it's not just a stepping stone to those higher quality, but it's also an integral part of our system, and we've been able to use this research and use this methodology to move our licensing system forward as well. So if you look at this slide, and as Dr. Fini has cited, it's revised from a young children in 1979. And to me, what was interesting when I looked at this slide was the separation between what is termed the non-regulatory methods and the regulatory methods as well. Because for us in Georgia, I wouldn't say that we would make these same distinctions. So for instance, having public education under non-regulatory methods actually in Georgia would also fall under regulatory methods because this is where many of our public pre-K programs reside, even though the program is administered out of this office. And then, looking at some of the other things under regulatory methods, some of what our quality rating and improvement system involves is not necessarily regulation, but also that training and some of those other pieces that are linked under non-regulatory. So I think that the lines aren't as clear as this slide would suggest, and I think that gives us an interesting way to look at it as we move forward. So
Bentley, this is Deb. Before you
Yes.
go on to the next slide, so in a way what you might be suggesting here is that each state would kind of craft this chart based on what happens in their own state. You know what I mean? As
Right.
an underpinning piece, is that? Yeah, okay. So that I can see what you mean about public education being considered non-regulatory there.
Right.
So each state might construct this in different ways based on the how things look within their state. And I know that some states, for example, regulate Head Start through licensing, vis-a-vis licensing, and some do not. And so examples like that might be different in each state, right?
Correct.
Okay.
I thought this distinction was interesting. And again, I'm not sure, how Dr. Fini would present this slide, but for me, looking at it through that Georgia lens, I saw things that were a little bit different from the way that they're structured here, as in what you mentioned too, that they would be different in other states as well. And I do like Ann Mitchell's quote, proof that things have changed since 1969. So thank you, Ann.
Exactly.
If you go to the next slide, so this is the algorithm that Dr. Fini used in doing his research. So before I get into this, let me explain a little bit of the history of Georgia's relationship, because I think that will help explain this. Several years ago, with our State Advisory Council, and we were able to begin looking at our whole licensing system and the way that we have our rules and our regulations and the way those translate into whether or not a program is designated as compliant or non-compliant. And I'll talk a little bit more about that when we get to the Georgia slides. So what Dr. Fini was able to come in and do was to take our licensing data and even some external quality data and look at the way that it fits into his methodology. And this slide really highlights his methodology and the way that he is able to measure it. So if you go to that top box that says Comprehensive Licensing Tool, for Georgia, that would be all of our licensing rules and regulations. And depending on whether you're talking about family or if you're talking about group or child care centers, then there would be a total of anywhere from 450 plus rules that fit into that. And then as he connects lower to our program quality initiative, so you have, program quality and professional development, and the way that those have to link to the licensing regulations which are inherent in that comprehensive licensing tool. Then if you go across, that comprehensive licensing tool links to a risk assessment tool. And this is where you look at those rules and regulations that theoretically might cause the most harm to children if they are not met. So in Georgia, we call those core rules, and they were developed with a group of experts who looked at all of our rules and regulations and determined that this subset were those that were the most important and were ones that needed to be continually monitored. You go down from that, and then you'll see the key indicator, whereas your risk assessment tool are more of your theoretical, or by looking at those regulations and determining that from a theoretical standpoint. Looking at the key indicators, these are your statistical indicators. These are the rules that predict overall compliance with all of those in that comprehensive licensing tool. And so one of the things that Dr. Fini was able to do with us was to look at which rules and regulations of ours actually serve as key indicators, and then are they correlated with our own core rules, or what in his algorithm is a risk assessment tool. And then those link into what he creates as a differential monitoring system. So based on a program's results with a risk assessment or a key indicator, that lends itself to a differential monitoring where you would visit some programs more than others based on their potential risk of not meeting all their different licensing tools. Now, I will say in Georgia, we do not use a differential monitoring approach that is listed in this context. Now, I say that, and I almost say differential monitoring per se, because there are some programs that receive more than the allotted number of visits. But in Georgia, all programs receive 2 visits a year. One is a full-fledged licensing study where all applicable rules and regulations are monitored, and one is a monitoring visit where just the core rules are monitored, and that's across the board for all programs. Using this model, you would use a risk assessment tool and maybe visit some programs more than others. But in the state of Georgia, we determined that we would visit all programs twice unless a program receives a complaint or there are other follow-ups that we need to do. So there are some programs that receive additional visits, but in Georgia, the general rule is that all programs receive 2 visits. And so I know that I just gave a lot of information on his algorithm. Does anybody have any questions, or Deb, is there anything you'd like to add to this before I move on?
Yes, I have a question. Are you surprised? No. So does differentiated monitoring, is it about the frequency of the visits to the program? And is it also about looking at like a core set of items, but then differentiating the items that you're reviewing when you're there? So is it almost like 2 tracks? Is it the frequency of the visit and what standards or regulatory things you're looking at within the program?
So Deb, the way that I understand it in the context of this algorithm, that you use a subset of rules to determine whether or not the full set of rules is conducted. So I think
you kind of look at that first set, and if you're finding a lot of noncompliance, you begin to add other sets of regulations that you're looking at.
Or you do the full set of regulations.
I see. Okay.
So, I mean, if his analysis indicated that there were 10 key indicators, and you went in and you looked at those 10 key indicators, and one of them was not met, then you would then go and do the full comprehensive licensing tool.
Okay.
If all 10 were met, then you would be done with your visit, and then you would do the same thing. That is the way that I understand it. Again, I do want to issue that caveat because that, this is an algorithm that he uses nationally, so I'm putting it in the context of the way we understand it in Georgia.
Does anybody have questions, or has anybody else on the call been operating using this type of a protocol within their states that are on the line? We have about 30 different states. I know this is kind of new for people to be thinking about how to do this. Have the licensing personnel then, what's been their reception to this type of a strategy or approach? We'll maybe talk about that when you get to Georgia's part. But we see a question in the box about do we have some examples of key indicators?
Yes, and Heather, if it's okay, when we get to the Georgia example, then I'll provide some of that.
Okay, perfect. And we can talk more. Let's talk then more at that time also about how licensing has reacted to this type of an approach, all right?
Okay.
So we'll come back to those. All right, thank you.
Okay.
Thanks, Heather, for the question, too.
So the next slide, and this is the last one from setting up the theory, and then we'll take some questions, and then I'll go into exactly what we looked at in Georgia. But this is the validation framework developed by Dr. Fini and Dr. Zellman that was published in 2012. And in Georgia, what we're doing now is we're actually using this approach in our quality rated validation as part of our early learning challenge. And then we're looking at the way that fits under our licensing standards as well. So I know that many people are familiar with this, so I won't go into a lot of detail, but that first approach, so just that content validity and looking at standards. And for us, in licensing, this would be where we developed our core rules. Then your second approach would be, are the measures you're using to examine those standards, are they appropriate and are they meeting the intended uses? So for us in Georgia under quality rated, this is where we do a lot of our inter-rater reliability, and I will add that we also do inter-rater reliability under licensing too. So I realize that's a reliability, not necessarily a validity, but to me that fits under that approach. From the third approach, it's looking at outputs. So for quality rated, this will be where we look at our quality rated system, comparing that system with other measures of quality that aren't in quality rated. So I know that sounds kind of confusing, but for us that'll be probably looking at the correlation with class in quality, since that's presently not an instrument in quality rated, and looking at that in connection with the way that we use environment rating scales. And then our fourth approach is looking at the actual outcomes, and in many cases this is looking at child outcomes. So in Georgia, we were able to use the first three approaches in this study in looking at our licensing system. We were not able to use the fourth approach because we do not have any child-level data that we can connect to licensing standards as of yet. But that, I think, will be part of when we finalize our scope of work for Early Learning Challenge. We will be able to do some of that, but that's several years out. So, Deb, before I move on to Georgia, are there any questions or any clarifying points you'd like to make?
Well, I have a question on that last slide. We have had at our QRIS NLN meeting last year, Marty Zaslow and Catherine Tout talking about diversifying the scope of outcomes that you're looking for out of your QRIS and expanding it with a nod to implementation science to other types of outcomes. So you, as well, of course, but those are, like, as you're saying, Bentley, further out getting to the child outcomes. So if you had outcomes articulated around professional development or professionalizing the field, or
Right.
family outcomes, or other intermediary outcomes, you might be able to draw some conclusions here in this fourth approach as well, right, about other types of outcomes. But I hear what you're saying. Certainly the one that we're focused on is the child outcomes.
Right, exactly. And I use child outcomes as an example.
Yeah.
It's not the only example. Though,
Yeah.
I mean, I have to, all of what you said is good and fine, but, when you're dealing with legislators and funders, they always want to know the impact for children. So we've got to just make sure that we're really able to answer that well.
Yes. All right, that sounds good. I don't see any other questions at this point about the underlying theory or anybody asking a question, so let's keep going.
Okay, so I will go to Georgia. Debbie, I just have to add that I love this image of our state that you put in. So I had not seen that in a while, and I actually found myself looking at all the different all the different images there. So what we did with the methodology that Dr. Fini provided was we commissioned a study, and the study was to examine the validity of the way that we determine compliance. So here I'll talk a bit about how that compliance determination looks, and then I'll share with what we did in the study. So first of all, it's just important for everyone to know that all licensed child care centers and family child care homes are given an annual compliance determination. In other words, we say that you are compliant or you are not compliant, and that is done once a year, and that is done for every program on the same day every year. So we essentially run all of our licensing data at the end of June. That's the end of our state fiscal year, and based on those visits, then every program receives a compliant or not compliant designation. What we wanted to look at is the way that we compute that, is this a valid way for looking at it? Is this a good way for designating a program, whether they're compliant or not compliant? When we started this work, and we started this work many years ago in the mid-2000s, around 2005, 2006, it was to look at the way our system was working, and did we need to provide more technical assistance? Did we need to do more for those programs? Or at the time, do we even need to visit those programs more? It was not meant as any sort of accountability measure. As the system has moved forward and we started looking at it, it has become a basis for participation in quality rated and participation in pre-K. It's not a basis for participation in our subsidy program as of yet, but we continually receive questions that will it be? So my point in saying that is it went from something that was more internal to something that was more high stakes. And so that's why it became so important for us to look at this. Also, you notice that we started this work, the actual validation, in 2011, but the validation model from Zellman and Fini didn't come out till 2012. So we were able to take their validation model and apply it directly to quality rated as our quality rated system was being implemented. And then we've been able to use it to sort of backtrack the work that we've been doing in licensing. And then last but not least, all of our validation activities are paired with inter-rater reliability activities. And I realized as I was looking at this, that's a bit of a misstatement because in many ways reliability is part of the validation activities. But for us in Georgia, we always want to make sure that we list that as separate. We do inter-rater reliability in a lot of ways. I mean, that's something that we're very public and transparent about doing here, and it's something that many of our providers ask us about. So we want to make sure that we're explicit that we do this. Kathleen has a question. Are there any programs exempt from licensing, such as pre-K, publicly funded programs? Yes. So our Georgia's pre-K programs that are in child care centers are licensed, but our Georgia's pre-K programs that are housed in local school systems are not. And I'm looking at Christy here, and we do have some Head Starts that are licensed and some that are not. Is that correct, Christy?
Right, that's correct. Some of our Head Start programs that are actually housed in public school systems choose to be licensed. It's a very small number, but that is one caveat to what Bentley stated.
Okay. So the next, and this is where I really get into some of the ways that we look at the way that we base this compliance determination. So as I mentioned before, we have a set of core rules, and those core rules are theoretical determinants. In other words, we looked at all of our licensing rules and regulations, and a group, an internal and with some external feedback, decided that these licensing rules were the most important in measuring whether or not programs were healthy and safe conditions. For children. And so we have this list of core rules. Depending on the services that a program offers and the type, being family or child care, it's about 79 to 80-something core rules. And many of them are in transportation. Many of them there's some in supervision, diapering, sleeping, hygiene and those things. And I do have some additional slides, and we'd be more than happy to share what those core rules are. There has been some change in those over the last few years. We've had some transportation incidences here, and so many of those rules under transportation are now core rules. So these core rules are observed multiple times during the year at both a monitoring visit and a licensing study. And when a core rule is cited, and this is only for core rules, then a severity level, low, medium, high, and extreme, is assigned. These levels are not assigned if it's a non-core rule. They're only assigned for the core rules, and that feeds into the determination. So from that, we go out, we look at programs, we cite core rules. Then to determine whether or not a program is compliant or not, we look at the number of times core rules are cited within their categories. So it's not looking at just the core rules, it's the categories which they are in. So, a program that receives multiple cites in one category, it's actually weighted a bit less than a program that received one cite in multiple categories. I think I said that right. So multiple rules in one category would weigh less than single rules in multiple categories. And then based on that and the level of risk, we take that and we determine whether or not a program is compliant or non-compliant. We do use what's called the annual compliance determination worksheet. Many of you in state government and other governments will understand this. For years, this was not automated. It was something that was done by, literally by hand in some places or on an individual spreadsheet. It was a big deal to do. In 2012, we created our own licensing system. We no longer use an external vendor, and we were able to bring that in under automation. And so we've been able to do that automated since that time. As you can tell by my stumbling a bit, the formula is complex, and it's not always easy to communicate. And while that may not, impact the validity, so to speak, or not, it is important in communicating this with stakeholders, and was another reason we wanted to make sure that we studied this. All programs receive their compliance determination on July 1st, and this determination remains in effect for the next fiscal year. So basically on July 1st, this program receives a compliance determination. We look at all their licensing visits over that past year, and that feeds into that determination, and that determination stays with them for a year. What that means is that all programs receive, so to speak, a blank slate at the beginning of the year, but it also means that you might be a program that had a really bad visit in October of one year. You were compliant on that visit in October, but then July 1st, based on that visit, you become not compliant, and then you stay not compliant for that whole next year, even though you may have visits without many citations. So even though, and I mention this because this is something that we're looking at, that is this the best way to do this. And then in fiscal year 13, the last year we have data, about 8% of our programs were determined to be non-compliant, and that's about 8% out of about 5,800. So even though it's only 8%, that still is a significant number. And Deb,
I was going to ask that question about rehab, so to speak, rehabbing your program and getting back into compliant graces. That is a strenuous period, isn't it? I know other states establish a provisional period or like kind of a lifting of the full license for a while, and the facility has an opportunity with another visit to come out from under that status. But isn't it interesting how in the face of the QRIS and the funding that goes along with it and so forth, how some of these decisions begin to hold a different weight than they used to in the prior context. Do you know what I mean? Like the synergy between subsidy, licensing, and the QRIS, and how that like tightens up the connection between those three operating systems is fascinating. And then this is an example of it. I can see why you might want to look at it again. Especially if do you have tiered reimbursement? I forget in Georgia.
Yes. So we had 2- and 3-star programs that had a licensing visit in the past year that made them non-compliant on July 1st. So that meant they lost their rating and then lost their tiered reimbursement. So yes, this is something with accountability, and for that reason, I mean, it's just so vital that we continue to look at it.
Yeah, that's great. Thank you. Any questions about that part of the work or about that?
And I know that gets complex. I'll be happy to explain it again or to further.
And we have a question. How many suspensions or revocations of licenses do you have based on this? Suspensions or revocations. So I would assume some percent of that 8% go into a revocation, right?
I'm going to ask Christy to answer that.
I will do my best. Currently, trying to figure out the best way to answer it. Right now, we're looking at a program may be non-compliant based off of different categories of non-compliance over time, not necessarily repeat categories over time. And so in trying to look at these programs that have demonstrated a non-compliance over time, we do take into consideration if the non-compliance is repeat in the category level over time or not. And that is also helping to drive our decisions around what is the appropriate sanction for those programs. Just off the top of my head, we have 70 programs that we have worked with, and some of those programs are in their 3rd year of noncompliance, but again, they're not noncompliant in the same category. Some of those programs are receiving a restriction for participating in some of our voluntary programs. Others did receive a revocation. I'm sorry I don't have the exact number, but I would say out of the 70 programs, about 10 are under revocation right now.
So again, I think the way to look at it is for us, as we have refined and developed our system of designating compliance, I mean, it only works in looking at participation in quality programs, but it also in just having a license in and of itself. But we're still figuring out the best and most fair way to look at that. So, Deb, I'm going to go on so I can talk about the study that Dr. Fini did with us. Is that okay?
Yes, that's great.
Just want to make sure.
Yes, that's great.
So what he was able to do, and to me this is really interesting. So we took a subset of programs, licensing programs in Georgia, and he looked at their licensing history data for a 4-year period. And from that licensing period, he then extracted the key indicators. So he took all that licensing data and he determined what those key indicators are. And I have a chart that I will explain in just a second to show a little bit how he did that. Then he went back and correlated those to our core rules, those theoretical designations, And then he also correlated our key indicators to program quality data. What was interesting with us in Georgia is just coincidentally in 2007, 2009, we commissioned an independent study to measure quality among a representative statewide sample. So this was done through FPG. Dr. Kelly Maxwell and Donna Bryant were the lead investigators with this. And I would just say that of different research that we've done, we have used those studies for many, many things. I mean, those have not been studies that have just sat on the shelf. And so it was not easy to do because that was independent of us and those programs had confidentiality to participate. But we were able to link the data with the quality data from those programs with our licensing data. And so that is how we had that quality data for him to look at, which then leads to the specific research questions that we developed. And, as an aside here, in working on this research study, and this was done by Dr. Fini, but we were working with him in the design, once we started this study, I don't think we knew what we didn't know at the time. And so these research questions were actually developed somewhat as the study was ongoing, which I know in Research 101 you would say, oh, you have your hypothesis, you develop those and such. But sometimes in the real world you have to come back and you have to reformulate a bit. So as we learned more of what we didn't know, these research questions emerged. So the first one, do our core rules serve as overall key indicators? So we know we have the theoretical rules, then do they also serve as statistical indicators with that? So that's the first question. Then the second question is, so we have those core rules, we then have a formula for designating compliance or non-compliance, and so we wanted to know, is that related to health and safety? Is that in other words, is that formula a valid way of looking at that? And then our third one, which gets to kind of that third process there, are the core rules for child care centers and family child care homes related to program quality. In other words, we had quality measures, ITERs and ECHRs, and we wanted to know how that related to that licensing data. We knew that was a representative sample, and we thought that was a good sample then to use in doing this work as well. Just as important, sometimes talk about what is done in what research questions are addressed. Sometimes it's important to look at what research questions are not addressed in the study. And as with our research questions, these developed a bit over time. So what this question, we have this way of looking at compliance, and we're curious as from a empirical standpoint how that relates to our data, but it still doesn't really address the overall health and safety of programs. So, we don't know from an empirical standpoint if all of our rules, address that as well. We assume they do, but it's important to say that the study doesn't necessarily address that assumption. Part of the reason is that since most of the programs are compliant, our data set is skewed, so it's not it's not a data set that's equally distributed. We also know that, to really look at health and safety, you need a large sample of programs where we have injury and fatality data. And we do have that data, and we've looked at it in a separate research study, but fortunately there's not many injuries and certainly not many fatalities. And so to have the data set you would need to really look at this, you would need many years of that, and this just looked at 4 years of data. Then we also, we use actually its core rule categories for designating compliance. And, we wonder, should we use the core rules themselves? And this study did not test out different models. Now, I can tell you that in moving forward, that is something that we will start doing, and we're developing new models to test out with that. But that's not something this particular study measured. And then last but not least, how should multiple visits be computed? So right now, we have a formula if a program's been visited 1 to 3 times, and then a formula if it's 4 or more times. And, as we're looking at different formulas, we wonder if it needs to be specifically related to how many visits, because the more often you're visited, the more chances you have for being cited. This next piece now, as a disclaimer, when we put together the presentation, this is when I was going to volley it back to Dr. Fini. So again, the part of Dr. Fini is again being played by Bentley here. But this is the way that he developed what a key indicator is. And so this is done for every single rule. So he looked at all 400 and something, 80 rules with this methodology here over that 4-year period. So if you go down the vertical side of the box, the high group, those are your programs that they were meeting 25%. They were the top 25% of programs in compliance. So these were the top quartile. Then your low group is the bottom quartile. So those are your two groups. Then he looked at, for each rule, what percentage or what number of those providers were compliant on that rule. So if you look in box A, those are your providers that, first of all, are at the top 25%, and on whatever rule he was looking at, and we could say here it was a transportation checklist rule, those were the numbers that were compliant in that rule. Your B column are your high groups that are not compliant in that rule. Then if you go to low group, again, those are your programs that are compliant, and if you look at number C in that rule, even though that they're the bottom quartile of compliance. And then if you look at box D, those are the ones, those are the rules that they are out of compliance with this bottom quartile. So it's the rules that fall in boxes A and D that when he does a statistical analysis are the ones that will come out and be those key indicators. And that's the way that he did that. Now, that's my best, explanation of the way that he did that. When you see the report, and the report will be released sometime within the next, I would say, 30 days. I know I've been promising that for a while. It's kind of like that elusive album that never gets released, but it is coming. We've just had to make sure we've had all of our language clear in the report. You will see a much more detailed explanation of this and some of the specific statistics that go along with that. So, what were the general conclusions of our compliance validity study? First of all, that the key indicators, the statistical pieces, do correlate with our theoretical core rules. So we do have that correlation. Now, when you have 79 or 80 core rules out of 480, then that's not surprising that we would see those correlations. But overall, we do see, we can say that there is the correlations. We also found that the key indicators, key indicators, also correlate with our compliance determination. In other words, that formula that we use to determine whether or not a program is compliant. And then the third analysis, looking at quality data, some correlations were found with quality data, and there are some different nuances there, and this has been part of the delay in the report. We're still figuring those and measuring those out. And then I just put the disclaimer because, I like to think of good research, this raised as many questions as it did answers. So what were his recommendations? So first of all, that we already have good core rules, and many of them do serve as key indicators, but he indicated a couple of other key indicators that we may want to add with that. And so when you look at our report, then you'll see what some of those key indicators are. So in other words, we would add new rules that would then also serve as core rules. He does make a recommendation of the report that we simplify the compliance determination worksheet. And, part of that is because there are ways that we could make that simpler, and I think all of us in the room would certainly like an easier system to be able to explain to providers and stakeholders. And then last but not least, use recent quality data for family child care homes to reanalyze the relationship between compliance and quality. Much has changed in our regulation of family daycare since that initial data was collected. And so those were part of those nuances that I mentioned that we had to go back and relook at. And so knowing that our oversight and monitoring of family daycare homes, family child care homes has changed significantly since that data was collected, that is something that we're looking at, and with quality rated, we'll be able to do that. And then last but not least, what are our next steps? So what are we doing with this study, and how are we moving forward with our system? Well, first of all, we're reviewing the core rules. Those were developed in 2005, 2006. there have been some changes, but it's time that we did a whole, formalized analysis of that. So over the next few months, we'll be looking with different stakeholder groups and our staff to examine all of our rules and to see if the core rules that we have now still are the ones that we would use moving forward. We also are going to continue to review our compliance determination formula. As I mentioned before, we have a couple of different models that we're going to be testing out, not in real time, but with existing licensing data. And then we will continue our inter-rater reliability. I could do a whole webinar on the challenges with that. I will say we do that with our pre-K staff, our quality rated staff, and nutrition staff, but it's our licensing staff that is the most challenging for inter-rater reliability by the simple fact that we have so many. It's our biggest division here at DeKalb. And so to do that in a way that doesn't take away from staff time in visiting and monitoring programs is always a challenge. And so that's something we're continually working on. We're also looking at the way that our validation with compliance fits in with quality rated. So first of all, is compliance an appropriate entry point? Is this a good way for, having entry into a quality rated system? And I know that many states are wrestling with that. Should that be separate or should that be that entry point? We also want to look at ways of combining this licensing data with both our portfolio data and observation data from quality rated. These are two data sets that we use in determining whether a program is 1, 2, or 3 stars. And what are some ways that we can combine that to, again, measure those existing relationships. And then last, we also want to connect both our compliance and quality rated data with our pre-K data. We are in a unique position here in Georgia. I guess it's unique, maybe it's not, but that we have our licensing system data. Then we have quality rated data that uses ERS, Environment Rating Scales, but then our pre-K program uses class. So, as we're looking at validation in both, we want to see if we can make some connections there. And I know our provider community would really appreciate that because, those are all different lenses, and what are better ways that we can connect that. So, all that being said, kind of giving you the program in a nutshell, and I have Christy here with me, and we'll be happy to entertain any questions.
All right, I see we have a question. Bentley, you talked about each program having 2 visits. One of those is to assess compliance with the core rules. If a program is in compliance with these core rules, do they still receive a second monitoring visit in that year?
Yes.
And if so, what's looked at during the second visit?
Yes, so one visit is a full licensing study where all applicable rules are measured, all of them, and then another one is a monitoring visit. And I don't know that, I think it varies which one comes first, the licensing study or the monitoring visit. Yeah, and core rules are looked at both.
All right. I have a question. Does this type of study and the relationship of your licensing data and what you're seeing, the relationship of that to quality rating, does that serve as a validation study itself? Do you know what I mean? Are you kind of validating quality rating through this type of
that is a great question, Debbie. Yes, I think we are. And, as we are looking at, doing our scopes of work for the Early Learning Challenge grant, and, looking at all of our staff time and what that grant means for our different projects, we're certainly viewing it as part of that. That is such a great question. And yes, I think so.
That's really an interesting, because we're all thinking about the validation studies using tools like the ERS or class or whatever that aren't, or the snapshot or whatever isn't in your QRIS, but this is kind of coming from the bottom up. You know what I mean?
Right, and so when we wrote our Early Learning Challenge grant, we didn't talk about compliance so much. But then, as we've been working on the scopes of work, and I'm working on the piece that looks at quality rated validation, I just keep saying this fits under that umbrella, and we have to look at this under that same lens. So to me, it very much connects and applies.
Well, we have another question here. Have the regulations changed in ways that altered the core rules? And you were talking, I think, a little bit about that in family child care specifically. And then what is the effect on key indicators and the continuity of your data over time as you see regulatory changes?
Okay. Hi, Barbara. It's good. Thank you for the question. Christy, what would you say that our regulations have changed in ways? I know that we've changed and we've added core rules because of that. Have they changed in any other ways?
The individual rules themselves may have been amended or updated. However, we haven't had any rules that changed the overall category of a core rule. So the rule itself may have been amended, but it was already a core rule in its foundation. But in the rule change itself, it may have added a core rule because of the way that we had to format the rule here for our Secretary of State. So like they have a special format that we have to follow when we do a rule change. So some of the rule changes actually added new rules, but it didn't change the category. That answer that? I hope that answers that.
Right, and on the next question too, the effect on key indicators and continuity of measurement. So yes, I would say it does. And you know, I mentioned before that Dr. Fini looked at 4 years of data, but now those 4 years of data, we're 2 years past that. And so I think we would need to look at those again and see if that's impacted what those key indicators were with that. And I think he would say that, and this is something that as a state that we need to make sure that we have the capacity to do, is to continually look at those key indicators.
You know, this is true, though, in any type of a study or that you're trying to do about whether it's the QRIS or looking at licensing in this way. You have to track the changes that are implemented through the course of the study, right? And then just kind of account for how do those impact the data that you're seeing, right? Like whether you change a TA approach or a financing strategy or whatever, that could impact results, and the researchers just have to be very careful to track those changes, right?
Right. You know, and I mentioned before, we've had a lot of focus in Georgia on transportation rules. And as in some other states that we know of, some of that was the result of some incidences that happened, including one very tragic incident where a child died in a van from being left on a van during the summer for too long. So because of that continued focus on that, and we've done a lot of, PR, a lot of, PSAs with that, and a lot more enforcement on programs just for not meeting those rules, whether or not there was an incident related to that or not. So that has in and of itself impacted our compliance rates and impacted the system too.
I think I heard you say that pre-K programs are not always licensed if they're in school district facilities, where we're assuming that they're following the school district standards at that point, right? Correct.
Pre-K programs in your child care centers would be, they are part of that licensing visit, that part of that regulation.
So how do you, I think that this next question in the box is getting at how do the school district standards align with the minimum licensing child care standards?
Well, I would say maybe ask me in a year.
Okay.
Look, as we're looking at increasing our participation in quality rated, one of the groups that we're looking at as being a part of that are our pre-K programs in local school systems. And so we're putting a pilot with that.
And when you have that, a lot of states are looking at the basic crosswalk of those two sets of standards, right? Like the school health and safety standards against the licensing standards, and then is there an underlying compliance addendum that you feel like you have to add into quality rating or not? You know what I mean? As the case may be. As you crosswalk and really look at how the standards relate to each other.
Yeah. Yes, and I think the other issue too that I touched on briefly was the fact that we used the class in our pre-K, and that was started years ago. But that means that, for many of our pre-K programs, they are used to that class lens. When you use an ERS, the Eckers instrument, that's a different lens, and that's created some challenges and opportunities here in using both of those. I see we have a question about how we do our inter-rater reliability with licensing staff. So there's been different ways, and I will say this, that we, as I mentioned, we do inter-rater reliability with all of our different divisions. I have tried my best to make that as stress-free as possible for consultants, and using it more as a quality assurance type of mechanism and not an accountability mechanism. And while I think that I can do a decent job at setting that up, I would say that I have not been as successful. I mean, there is a lot of stress with this, with doing this. And, for a lot of our licensing staff, they're under a lot of stress to begin with. So we do look at ways of minimizing that. What we have done in the past is we have, like you would expect, we have anchors. The anchors all make sure they're reliable with each other, and then they go out with licensing staff. And when we did this as a full-fledged study, we were able to, really just do it once or twice a year with staff. We do set, a pretty strict protocol. They go into a program together. They go in side by side. They don't talk during the visit. When the visit's over, they take their sheets that they've done the visit on. They make copies, and they send those to us immediately. Then they go and have their discussion. So we base the reliability with each other, not against a consensus measure. I know there is some discussion on the field about doing that. That became very time-consuming to do. We also felt that many of those visits were based more on teaching to the test, for lack of a better term, than they were about what consultants actually were doing in the field. So where we are now is we've taken a step back. We have, in our new system that we developed, really detailed reports, so we're able to look at the percentage of visits without any citations, percentage of visits with only core rule citations, percentage of visits without core rule citations. And then we're able to look at that, look at the average across the state, and then look at what that looks like for individual consultants. Based on that data, then we either assign follow-up visits with consultants, we assign additional professional development, or we do more of those paired visits. But we do say, you would expect some variation across the state. I mean, our consultants are geographically assigned, but we see enough of a difference in places that it does raise some concerns, and so it's something that we're continually looking at. But, several years ago when we started this, we didn't have the data capacity that we have now. So, I'm looking in front of me at one of these reports, and we're able to fairly quickly monitor this data and look at where it's going. In our pre-K program, we'll run all the class data, and then we'll do the average, and then we'll show each consultant where they are in relation to that state average. And so that in of itself becomes a good PD part. Though, of course, the consultants using class also do those standard reliabilities. Do your licensors provide technical assistance to programs?
Yes, we all of our regional and our specialty units do provide what we call line of sight TA, which is basically TA during the visit. In Georgia, we do instruct our consultants to cite what they see in a program because it also is sometimes necessary if a program is going into adverse action and we're going to hearing. So we believe that it's important to document the citation, but we also turn around and offer technical assistance on the same citations. In addition to that, our staff do or issue state-approved training, which may be specific to a certain core rule category where we will go at a center's request, or sometimes it may be at the consultant's recommendation that staff attend this particular training. And so we would encompass that with all of the TA that we provide. In addition, we're very fortunate that we have launched a TA unit This is a new unit in Georgia that will specifically do compliance technical assistance to our programs that are struggling, and there will be different, intensity levels of TA provided to a program based off of that program's performance. So if we have a program going into their second year of noncompliance, then obviously they would get a higher dose of TA than a program who has historically been a compliant program but maybe had, one or two things happen in a year that would not require as intensive TA.
That's very helpful. Thanks for explaining that. On the flip side, when your designators for quality rated or TA folks go into a facility and see a licensing violation, have you worked on, how do they report to the licensing folks, or what's the relationship there in terms of how you've knitted that together?
So we made a policy decision about how we would handle that, and basically what we decided in Georgia is that for every core rule, there's a designation of the severity of the citation. Any rule that is cited or that a person providing TA, if they see that rule violation at a medium or a high severity level, it is reported to the licensing consultant.
I know that that's a challenge to develop those protocols between the different players within the system, but I really appreciate how Georgia's taken a careful look and done some policy development in that area. That's really great. In terms of the databases for quality rated and licensing, do they speak to each other? Can the licensor see the QRIS history and designation, and can the quality rated folks see the licensing history? Do you have look across at all?
Yes, and we're still developing that. There's still, some issues, and there's still some, communication issues, not only in the technical side, but just, in a state as big as Georgia and between assessors. But we have been really fortunate with our new data system that they really do talk well, and we've been able to, populate some quality rated fields from licensing and look at some of those and have cross reports and stuff.
Right.
So do the licensing staff give some basic information? There's a question from the question box. Do they provide some basic information when they're doing their monitoring visits about QRIS, especially for newer facilities?
All new facilities, actually, it's part of their exit conference when we call them applicant services unit consultants are going to do the inspection visit to either issue PTO, permission to operate, or not. And as part of that exit conference, we do go over quality rated. In Georgia, they have to be licensed for a year in order for them to participate in quality rated, but we have developed a fact sheet or a one-pager specific to new programs so that they're aware of it on the front end. There's also a different kind of fact sheet for our regional consultants. We have a current initiative going on between licensing and quality rated. Our board just adopted some new rules which would require transportation training for our drivers and anybody involved in transportation of children. And so working with quality rated, they will actually develop a training that meets the rule requirement. And so anybody participating in quality rated gets to attend that training online free. And so that's another way that we really try to encourage also participation in quality rated, because it helps them to also meet the licensing rules.
So we have a question, do specific non-compliances for an individual provider get published for public knowledge? Yes.
Yes. In July of 2012, we started publishing the compliance status for the previous fiscal year, It also publishes, and it goes back for 2 years now, and it also publishes their projected compliance based off of that current visit.
I have another question. So there's transparency about that for the parents and for the stakeholders and the public. Do you see this notion of differentiated monitoring in the long run as you kind of work through it or whatever, helping states in the QRIS portion of the work get to the few and the powerful? Now, I know that when you have a hybrid or a point system, you're already differentiating the weight that you're giving to a certain standard in terms of importance, right? But do you see it in terms of being employed in terms of the designation of the facility, that you might look at these 4 or 5 core items and then select a randomized sample of the other items to look at when you're designating a program at a quality level? Like, do you think that this work that you're doing within the state is going to, over the long haul, inform, the quality designation side of the house, so to speak?
I think it can. I think it's a little too premature to say exactly what that's going to look like. I know that in Georgia right now we're looking at the renewal process for those programs, and knowing that you don't have the resources to do an ERS once a year, then what are some of the things you can monitor for those programs to see that they're continually meeting those other high standards? And so I think that's one area where we could really see this methodology work.
Well, that's a good point, Bentley, too. It's on the renewal of a quality level, maybe not on the initial determination of a quality. So that was a good point that you made there. But keep going. I like that one.
Now I lost my train of thought. I think for us, what we found in doing, initially when we developed our compliance system, we looked at more of a differential monitoring, and those that were at higher levels received less visits. But what we found was, by the sheer fact of going to some programs more, you increase the likelihood that they would be non-compliant because they have more of an opportunity to be cited. And so it just seemed to be much more equitable and better for the system to ensure that all programs were visited twice a year. If you go to some programs being visited 3 times a year, then that means that other programs only get visited once a year. And so it becomes, and then we found that we were increasing the likelihood. Now at that time we were not adopting the key indicator approach with that, so that might have changed the outcomes of that. But initially that was our experience with doing more of a formalized differential monitoring. But again, programs that receive a complaint visit and require follow-up to check on certain items and everything, many times the core rules are looked at those visits. So we do have programs with more than 2 visits. But as a formal policy, each program is reviewed twice a year.
Well, this has just been so interesting to hear. Are there any final questions from our audience or comments about how you might use it in your state, or what you might be feeling about how this applies to what you're seeing within your state?
Right. And Debbie, I've just put up the additional information for contacting me and Dr. Fini. If anybody, Christy Lewis is a wealth of information too on our process and procedure. So if anybody has any questions for her, they can email me and I can pass those on. Well, she's down the hall. I can print them off and take them there.
You know where she is, right?
She is.
Well, thank you guys so much for helping us with this today, and we'll post all this information. We have a final question here that just popped up. For content purposes, how many family child care programs are there in Georgia? Like, they want something about your licensure to program statistics.
Right now we have about a total of about 5,600 programs in Georgia. It's a pretty even break. It's about 2,900 programs for Child Care Learning Center and family. It has fluctuated some, so whatever 29 and 29 is, I think that's 5,800, so maybe 100 or 200 less on one end. We have actually 80 people that we consider to be licensing consultants. With that being said, we have specialized our units out in Georgia, so roughly in the field, in our regional, we have 5 regions, and those regions are comprised of about 60 licensing consultants who do the routine monitoring and inspection of child care programs. We have an applicant services unit, which is our unit that licenses all new programs and handles change of ownership and change of locations. And we also have a specialized complaint unit team, and they roughly investigate about 450 of our most serious complaint allegations per year. So we've specialized our units out. If you were to take our total licensing staff, I think right now they would be at about a 1 to 75 or less workload. Bentley was very helpful in helping us to do what's called a weighted map in Georgia. So over our 5 regions, we looked at each county, applied a weight to the county. We looked at number of programs, capacity, number of complaints, whether or not that county needed to be served by multiple consultants or one consultant. So our actual workloads are actually based off of what we call a weighted workload. I know that was a lot in a nutshell, but that may be a topic for another day.
Yeah, that's very interesting.
Been doing that for, I think, going into our 3rd year now.
And it's worked.
And it's worked wonderfully.
So what I'm hearing you say, too, is that the licensing consultants have been very open and interested in thinking about these core elements and how to do the work in an efficient and reliable manner. Like that the reliability is coming along, but they've been open to this way of looking at the licensing visit.
Right. There is a we have a report on our website that was done by Donna Bryant from FPG that it's a very in-depth look at our whole licensing and monitoring system, more from the regulation and consultant point of view. Mm-hmm. So it was based.
Oh, that's neat.
And it's a really good report. Well, I mean, obviously it's well written if Donna did it, but it's a very in-depth, thorough look. And that is
so maybe we can snag that and put it up with this set of slides in case any of the participants today are interested in having a look at that. It's right on the decal website?
Yes, I'll send it to you.
Okay, great. Then we'll post it so that if you're interested in digging deeper into that, you can just have a quick look at it. Thank you, guys. Well, thanks again so much for all of your talking with us today. And Bentley, thanks for standing in for Rick and wearing 2 hats in the presentation. We really appreciate it. And thanks to everybody that participated today, and we'll look forward to talking with you again next month about a Massachusetts experience with the National Association of Education for Young Children and working to align processes between the 2.
Oh.
Goodbye, everyone.
Thanks,
Bentley. Thanks.
Thank you. Please stand by.